Shifting dullness is a simple bedside technique used to detect free fluid, or ascites, in the abdominal cavity.
Ask the patient to lie flat on their back, with arms resting at the sides. Ensure the abdomen is relaxed. Begin percussion from the umbilicus outward toward the flank. Listen for a tympanic note centrally and dullness at the flanks.
Mark the point where the sound changes from tympanic to dull.
Now gently turn the patient onto the left lateral side and wait for 30 to 60 seconds.
Repeat percussion from the uppermost flank downward. The previous dull area should now become tympanitic as fluid shifts downward and bowel floats upward.
Babble. Imagine the abdomen as a basin of water with a floating balloon. When tilted, the fluid moves and the balloon rises.